This video is brought to you by Haven House Recovery Center. Major effects, signs, and possible treatment options of heroin addiction. The DEA keeps heroin in the same legal, regulatory category as other dangerous substances. They are classified as Schedule I drugs. It currently has no known medical use, with potentially severe psychological or physical dependence. It acts as a positive reinforcement by activating brain receptors responsible for pain regulation and good feelings. Heroin users often enjoy a rush feeling from the drug when it reaches the brain too quickly. Generally, the effects of heroin may include apathy, contentment, drowsiness, euphoria, relieved tension, reduced anxiety. The sudden rush of positive emotions and happiness, which can often be enjoyed for several hours, makes heroin a crowd favorite, especially the youth. The wide availability and cheap price of the drug also contributes to heroin abuse. It is now cheaper than ever. Most people now choose heroin over other opioids because it doesn't require a prescription for dealers to access. How can you tell if someone is addicted to heroin? While heroin track marks are often seen in cases of addiction, many new users are now using other techniques to ingest. It's important to be familiar with the other signs of heroin addiction, including bloodshot eyes, changes in appearance, extreme drowsiness, pinpoint or constricted pupils, sudden weight loss, lack of motivation, secretive behavior. A heroin addict also often uses excessive amounts of medications longer than prescribed, spends more time in activities needed to procure and use heroin, has cravings, fails to complete duties at home, work, and school, compromises personal and social relationships, has financial problems. Why do people abuse heroin? Causes of heroin abuse or addiction may vary. While genes may play a role, lifestyle and environmental factors often increase one's risk of heroin addiction, and these include habits formed around pain relief, history of substance abuse, childhood abuse or neglect, depression, impulsivity, residing in rural and low-income areas, affiliation with people who abuse heroin and other drugs, easy access to affordable street heroin, easy routes for drug administration. What are the side effects of heroin abuse? Depending on what administration is used, users may experience several side effects or medical complications. Generally, heroin addiction symptoms often include shallow breathing, dry mouth, insomnia, constipation, tongue discoloration, very small pupils, slow pulse, bluish lips. By injecting heroin, users may be at risk of bacterial infections of the blood vessels and heart valves, collapsed veins, skin infections like abscesses and cellulitis, hepatitis B and C, HIV or AIDS. Smoking or snorting heroin may cause several other side effects, including lung diseases, including tuberculosis and pneumonia, damage in the mucosal tissues in the nose, nasal septum perforation. Chronic users may also experience other medical complications, such as depression, sexual dysfunction, irregular menstruation, arthritis and other rheumatologic problems, miscarriage. Heroin treatment options. Heroin users are often hesitant to ask for help for addiction. Many may attempt to stop on their own but fail. Unlike other drugs, heroin withdrawal symptoms are severe, causing immediate pain. This calls for professional help. Seeking therapy can help with any emotional and spiritual issues one may have, even before addiction. Support groups are also very much available in our distraction-free environment. If you are looking for a Clarksville recovery center, consider Haven House in Hartsville. You can count on our experienced, compassionate staff. Call us now at 850-622-3774.